When I worked at the hospital, Dara Muller was my partner in crime, and I, as the chief of radiology, and she, as the administrator of radiology, worked together for a long time. But we both decided, for a variety of reasons, to move on from the hospital, and we both decided to explore CCSVI in the next phase of our careers. Before Dara was an administrator, she was a chief technologist in ultrasound. And when I moved on to American Access, the first person I called was Dara. And I asked Dara if she would become an expert in CCSVI ultrasound technique as described by Zamboni. Dara and I have worked together for a long time, and Dara has met the expectations I had of providing really excellent ultrasound for CCSVI in American Access. And she shared that expertise with a number of people in the organization so that we have a number of centers that can perform the ultrasound for any of the physicians treating CCSVI. So I've asked Dara to review the nuts and bolts, the nitty-gritty of the ultrasound exam for the patients. This is not simply to talk about the science, but talk about how the patient will experience the ultrasound. Dara?
Well, I have to say, honestly, I was a little concerned about following Mark before we started talking about tickling hearts and penetrating areas. But this is a very general, basic ultrasound. Many of you have been my patients, or we've talked, you've shared a lot with me. You can tell me how I stood up to what I believe we should be doing. Okay. Ultrasound, definition. The use of sound waves to visualize soft tissue structures and blood vessels in the body. We're using sound waves. It's non-invasive exam. There's no radiation involved. It's normal and abnormal anatomy can be visualized. It's a dynamic evaluation. You'll be put in different positions, lying down, sitting up. Real-time exam. We're watching exactly what's going on in your vessels while we're performing the exam. And sometimes that takes a little time to watch the dynamic process of the vein. Ability to utilize the respiratory phases. Dr. Sclafani and I have gone over 1 million times. What phase were they in when you took the picture? Did you ask you to take a deep breath in and blow it out? Did I ask you to hold your breath? So all that happens during the process. What are we looking at? You all know what we're looking at. The jugular veins, vertebral veins, and the deep cerebral veins. What are we looking for? We're looking for reflux in a number of different veins in different positions, flow blockage, or an episode of no detectable blood flow via color and/or Doppler signal evaluation. May be there, the flow may be there, but I may not be able to see it by the detection of ultrasound. Stenosis, or the narrowing of the vein, a septum or a flap. We look at the annulus, the valve leaflet motion and thickness, and we take some measurements specific to the Zamboni protocol, and also in American Access Care we take some additional measurements to help Dr. Sclafani along with the balloon size. Patient preparation. Hydrate. Drink your water. Within 24 hours of the exam, drink about 16 ounces of water. Wear loose-fitting clothes. No turtlenecks, please. When we first started to do this procedure, it was in the middle of a very cold winter, and I was struggling with double turtlenecks. Sorry. Okay. No long flights or air travel within 24 hours of the exam. Remove necklaces, long earrings. Tie your hair back if you don't want to get that gel all over you, and we'll talk about the gel soon. No gum, and remove your glasses. Relax. The exam is going to take between 45 minutes to 60 minutes. Okay, the gel. You all know about the gel. It provides an acoustic coupling between the transducer and the skin. which allows the sound waves to travel through the skin surface. It's water-soluble, hypoallergenic. We've been trying to warm it, and we use lots of it. The gel allows us to put less pressure on your neck so we can evaluate the veins better. Patient positioning. The first item is stretcher, but we'll come back to that in a minute. You usually start the exam lying down, 0 degrees, supine position, and you're asked to lie flat on your back with your head in a neutral position with your eyes facing forward. Then we proceed to an upright position. Imaging the measurements, again, repeated while you're sitting with your back straight up and your head looking forward. What we recently have been doing is I've been putting little purple marks on people's necks so that we can measure the same spot in both positions. And people keep asking me if it's a tattoo, and they're kind of excited about it, coming to New York and getting a little purple tattoo. Okay. Oh, sorry. Patient positioning concerns. Now, please, if we forget to ask, and if I didn't ask, I apologize now, tell us if you're unable to lie flat for a few moments. If you need assistance on or off of the stretcher. If you'd like a pillow under your knees. The first thing I typically do is take the pillow away from you so I have better access to your neck. If you're feeling cold, would you like a blanket? Okay, ask. We're happy to accommodate. Patient positions. We talked about the stretcher. Some people have motorized wheelchairs, and rather than getting up onto the stretcher, they would rather recline in the wheelchair. It goes back almost to about 0 degrees. If you're going to be lying for a long time and you know that it may trigger some spasms, we can start with you sitting up and then go to the lying down position. Okay? Where are we going to scan? The majority of the imaging is going to take place on either side of your neck. For the transcranial portion and evaluation of the deep cerebral veins, the transducer is going to be placed just in front of your ear. Okay. For evaluation of the Rosenthal veins, the transducer will be placed just above and slightly behind your ear. Okay. Ultrasound equipment. There's a lot of different systems out there and they vary. So don't be too worried about what kind of machine's being utilized. One or more transducers may be used. The color Doppler, that's pretty much a must. You'll evaluate the direction and velocity of the blood flow in the veins, and you'll hear the whooshing sound. Questions. Will the exam hurt? I'd like to say you're not going to have any pain at all. A lot of you have shared your experiences of ultrasounds done elsewhere. And for the most part, it's not going to hurt. The gel will be warm, so you shouldn't have to worry about the cold gel anymore. And you might feel a little pain sometimes if we're down by the clavicle and we're taking a really good look at your the valve. You might feel a little pressure there. But for the most part, we try to be gentle when we do the evaluation. And if there is any pain anywhere, please do let us know. Will Dr. Zamboni's protocol be followed? Within American Access Care, we've tried to standardize what we're doing. As Dr. Sclafani had mentioned, we have facilities throughout the country, and we are trying to do that standardization. And yes, we will be using the Dr. Zamboni protocol. Deep cerebral veins. It may not be performed at all sites. It's preferred, and there's certain equipment that makes this process a little bit easier. And if they do have the equipment in the system, it's preferred that you do have the deep cerebrals done. The criteria number 2, Dr. Sclafani mentioned earlier that they're, instead of using the 5 criteria, they're moving to 4 criteria and be positive for 2 of the 4 criteria. But yes, we are following the protocol. Will the exam protocol always be the same? There's lots of different things that are being done out there. You have research, which may take 2 hours or a little bit more, versus diagnostic. The pre or post procedure. The evaluation pre-procedure, generally right now I've been pretty much doing the same for all, except for patients that have a clinical suspicion of diagnosis of thrombosis. And then you can have a compression ultrasound done. And if you've come to us or anywhere else and you're traveling back home, you can pretty much go to any of your local imaging sites for a compression study for ultrasound. VHISS. This is a little bit more involved, where it's a scoring system to grade the severity of the CCSVI, which means that you're taking a couple more information, different imaging positions, both right and left side. Thank you.